one of the most important things faculty can do is to care about students. And by caring about students, students will learn about how to care for others. And that has always resonated with me, that if we take care of our students, they will learn how to take care of other people. They will come to epitomize that concept of caring. And I think many of the comments that we have heard about UNH students is that not only are they bright, not only are they clinically competent, but they also have a deep dimension of caring.
The thing that probably is best in our society is the fact that it's changed nursing so here in the state of New Hampshire, because people were never used to baccalaureate nurses following through with the kind of care that's given even today, of knowing that it's our students who are out there that are promoting the kind of changes in care and the care for patients.
When I graduated, my first job was at Wentworth Douglas Hospital. And of course, back then you did an orientation for 2 weeks and then you put in charge of a floor 3 to 11. I was in charge of the 3 to 11, one of the med-surg floors. And one night they said, "Oh, you have a nurse covering for someone else, who will work with you tonight." And all at once I heard this little voice said, "Well, hello, Allison." And I looked up and there was Ann Kelly looking at me. Well, being out of school for like a month, you're in charge of a floor, and there's your med-surg faculty looking at you saying, "I'm working with you tonight." I was like, oh my gosh.
My most memorable experience as a student here at UNH is participating in my medical surgical clinical. I'm in the dedicated educational unit program, so I've been paired with a preceptor at Portsmouth Hospital for the entire year, and I've really gotten to develop a relationship with her and go back week after week and kind of grow as a nurse with her, guiding me one-on-one.
Nursing has changed in many ways. Right now I think it is a very respected profession with a solid body of knowledge, which we did not have at the beginning of my career. And actually it has grown in its autonomy and its shared decision-making within the healthcare field.
The best part about being a nursing student at UNH is the variety of clinical experiences that we get. I've been in many different settings, hospitals, different floors, and I know that at some other programs you don't get as much clinical immersion. We start our clinicals as a sophomore, and a lot of programs don't begin until your junior year.
Med-surg was pretty memorable. That was our most difficult class, so the stress with those quizzes were quite memorable too.
The projects that we have our students do now and that I did as a student, researching the literature, making sure we're handling both the art of nursing and the science of nursing, that we have those two together and we use it with a lens of evidence-based practice really allows us to get out there. And if you are a person that's excited to make change for the better, you have the tools.
I actually had heard it at UNH in both the programs, that we were moving towards more of a ambulatory focus, care coordination, and actually it's occurring now.
I worked in a hospital environment for 3 years, and that was obligatory. You did your 2-3 years of med-surg nursing, then you could do your specialty. That was the rule. And I went right into public health, and that was the best thing I ever could have done.
And actually, I think the inpatient nursing arena is really going to be a very small component of the nursing profession. And so it's really an exciting time, I think, because it's really, nursing is really, I think, evolving in a different dimension.
In 10 years, I see myself commissioned in the Air Force as an active duty nurse and making a difference around the world and learning the skills I learned at UNH to better the world.
It's definitely a milestone, and it's, you kind of take some pride with it too. You graduated here, they taught you everything you know, so it's kind of special that this program's been around for 50 years.
We should be proud, and I think we've graduated a lot of nurses who have gone on to do really incredible things, and that we strive to always be innovative and change. And so over 50 years you can look back and feel good about where this program is right now.